We are launching at the Center for Health Transformation, which you can see at healthtransformation.net, a health-based health reform model that I'd urge all of you to try to get your committee, whatever committee you have on health in your state legislature, should look at health-based health reform. Simple model. The Gunderson Lutheran Hospital System in La Crosse, Wisconsin, is the least expensive place in America for the last 2 years of life, according to the Dartmouth Health Atlas. It costs $13,600 for the last 2 years of life in La Crosse. It costs $58,000 at UCLA. They have a higher satisfaction rate than UCLA. Families feel better about the experience, and they do 4 things. Over 90% of their patients have an advanced directive. They have an electronic health record, so the staff knows what the directive is. They have palliative care, so they take care of people who are in pain, and they have hospice care. Now, if you simply went out and found the best practices in your state and insisted that over the next 3 years, all the hospitals and doctors would migrate to best practices, you would take out virtually all the cost increase in Medicaid and in your state employee health cost. But it's a new model. It's a model that says don't cut across the board, don't use a meat axe, accelerate the adoption of the best practices to lower the cost and improve the outcome, which is what we historically have done in manufacturing for 200 years, what we don't do in health. So it's a fundamentally new model. Second, let me go back to honesty. The New York Times reported a couple years ago in a 4-part series that Medicaid in New York is 10% pure fraud. Not waste, not abuse, not judgment, but a dentist who filed 972 procedures in one day. A dental office, which had a person standing out front who said, if you'll loan us your state Medicaid card for 30 seconds, we'll give you a free DVD player. Now, we have had no serious effort at taking fraud out in this country, and I'm not saying this is true of every state, but there are a lot of states that would save billions. New York State, by the way, 10% is $4.4 billion a year in fraud. And Jim Froeg, who's here from the Center for Health Transformation, many of you know Jim from over the years, Jim would be eager to work with you on Medicaid reform because we think there's a ton you can do there. The third point I'd make is, both for Medicaid and for your state employees, go to incentivized systems. Allegiant Hospital System in Omaha, Nebraska has 93% of its employees now signed up for incentives. So if you're diabetic and you're compliant, you get rewarded. Every person does an assessment of their health every year. Every person is rewarded for doing well. They're not rewarded for not doing well. They've had a very big impact on the cost of health care for their employees. They have 9,000 employees. But all of you should have an incentivized system for health so that every person knows their own health status, every person is involved directly in minimizing their cost. Finally, you look at community-based models. We have a project in Columbus, Georgia, which Laura Lynn and the Center for Health Transformation has undertaken on diabetes and on obesity, which we'd recommend you look at. There's also a great project in Oklahoma City where the mayor, Mick Cantor, decided that Mick Cornett rather, decided that he would never lose weight. He'd always been 40 pounds overweight. So he announced last January that the entire city would now lose weight. He has had a citywide project on diabetes and obesity, and the city, as of September, had lost 176,000 pounds. It is a great case study that all of you ought to look at because obesity and diabetes is now probably the largest single health problem we have in the country. It's really worth your looking at.